Preventative measures that we take as like from start to work health program side, we do awareness at the workplace, whereby workers are going to be given information around HIV and the modes of transmission. And from the employers themselves, what we usually do, we leave condoms at the workplace. We also leave gloves. Let's say there's a worker perhaps who needs to be attended to and there's blood involved, so that they can know that they must wear protection. So those who test HIV negative also to try and stay negative as much as they can. We do a HIV awareness whereby our training department goes and do talks around HIV, and then the HCT, that is HIV counseling and testing team, will go there and do group counseling sessions. Thereby then a nurse will come and do the actual fingerprint test. Those who test positive are entered into our wellness program, and then we do CD4 count on the spot. Those who are eligible or have CD4 counts that needs them to be put on ARVs, they are started on ARVs. We are operating in 5 provinces. We, however, have one ARV site that is in Durban. It just has been accredited right now. We also offer, on top of HIV, a whole program whereby we offer chronic diseases of lifestyle testing. We call them CDLs. We test people for sugar, we test people for blood pressure. We also, as part of the HIV program, we screen them for STIs because of the link, and also screen them for TB, also because of the link between HIV and TB and HIV and STIs.
But if you contracted such disease at work by accident or any other form, it should form part of compensation, which is not yet been inserted in the occupational health and safety, because I've said earlier it's a new disease and it's a new challenge that workers are faced with in the workplaces. But now, in terms of the work that government and the employer should do, they are not doing enough, because this thing we need it to be regulated, separated to any other regulations in terms of the law. Once you contract this disease, there must be catered advantage or benefits for this person. For an example, employers, including government, are still failing to make sure that workers do have access to quality medical aids. For an example, you see on the wage negotiations that workers will demand access to medical aid, which companies refuse, are saying this is expensive. So one of those things implies negatively to the part of the employer and government in improving the services in this regard. Because if you look at public health facilities that are mainly used by workers, they don't have capacity to deal with this scourge. But if employers and government can get together with the workers and make sure that we've got access to private or quality healthcare, this can be an advantage to workers. Definitely, we feel NHI is one of the processes that can be followed in order to make sure that we equalize the services, in particular on health, so that we can have access equally with anyone in the country, more especially the HIV and AIDS. Once we improve infrastructure in those areas where there is a need, once you improve budget in those areas where there is a need, now it simply means workers can go confidently to public facilities and make sure that they access quality healthcare. Not to say, for me to be in a quality healthcare, I must have money. Government must provide this. That's why I'm saying in the first clip that they are not providing enough support on people living with HIV and AIDS or any other disease.